Chapter 13, Environmental Emergencies. When a person is exposed to excessive heat, the body mechanisms for regulating temperature can be overwhelmed, resulting in heat cramps, heat exhaustion, and heat stroke. Exposure to cold environments may result in conditions such as frostbite or hypothermia. Unintentional exposure to water can lead to submersion injuries and drowning. Always remember, when we assess our patient, scene size up, primary assessment, is he alive or dead? Does he have any life-threatening conditions? What are the baseline vital signs? History taking, emergency assessment, secondary assessment, sample and dots, and then obviously in a stable patient, reassessment every 15 minutes, okay, or in an unstable patient every 5 minutes, although you should continuously be talking to your patient and assessing him just from a visual aspect all the time. All right, we obviously need to be aware of scene safety issues. As you do your primary assessment, try to form an impression of the patient's condition, determine the patient's level of responsiveness, AVPU, introduce yourself to your patient, okay, check the patient's ABCs. Obviously, if the patient responds and talks to you, he has an airway. Is his airway good enough for maintenance of life? Is he breathing between 12 and 20 breaths per minute? Once you've established these things and the patient's alive and out of danger, then we can acknowledge the patient's chief complaint. Usually it's best to collect a medical history from the patient before you perform a secondary survey, such as a sample history. Secondary assessment focuses on areas related to current illnesses. Obtain the patient's vital signs, reassess, and monitor ongoing. Heat cramps can be painful involuntary spasms of muscles. Often occurs after exercise, especially in hot weather. Occurs most often in legs and calves, especially in people that are standing or working. When abdominal cramps occur, it may appear that the patient is having an acute abdominal problem. Okay. Treatment: move the patient to a cool place. Have the patient lie down in a comfortable position. Give him plenty of water to drink. You can also dilute a balanced electrolyte solution in your drink. We're going to rehydrate here in this country. Otherwise, make something up that you can on your own. If cramps do not disappear, if the patient is young, old, or has a chronic medical condition, arrange transport for the patient to a medical facility. Okay, heat exhaustion occurs when the heat patient is exposed to temperatures higher than 27 degrees Celsius, usually in combination with high humidity. It can also be a result of vigorous exercises at lower temperatures, especially if you've got a lot of clothes on, trying to keep yourself warm. The heat can't escape. Okay. Signs of a heat exhaustion include profuse sweating, lightheadedness, okay, dizziness, nausea, vomiting, a weak pulse, low blood pressure, all signs of hypovolemic shock, okay, especially where excessive sweating has taken place. Loss of body fluids is a very serious condition. Predisposing factors which make people more susceptible to heat exhaustion: the very young or the very old. Okay, those people with pre-existing medical conditions. Certain medications obviously would also influence these factors of heat exhaustion. High air temperatures, okay, and high humidity, especially around the tropics, places like that. Move the patient obviously to a cooler place. Treat him or her for shock, okay, unless the patient is unconscious or nauseated or vomiting. Give fluids by mouth. Electrolyte replacement's also a good idea. Not too much though, don't overdo it. Monitor the ABCs, airway, breathing, circulation, and arrange for transport to a medical facility. Heat stroke occurs when the body is subjected to more heat than it can tolerate. Normal mechanisms of getting rid of excess heat, such as sweating, are overwhelmed. The patient's body temperature reaches a level at which brain damage occurs. Okay, your body goes measured rectally, goes above 40 degrees. There's a definite probability of damage to the body, the brain, things like that. The skin will be in the signs and symptoms, flushed and dry. There will be no longer any sweating going on because there's no more fluids the body can get rid of. Okay, the mental status may be decreased. Okay, unresponsive and comatose. There may also be hallucinations and things like that. So be prepared for lots of things. Okay, as I said, internal body temperature is above 104 Fahrenheit or 40 degrees Celsius. Always remember to watch and maintain ABCs, airway, breathing, circulation. If any of these fail, please begin CPR immediately. Remove the patient from the heat. Okay, remove unnecessary clothes. Soak the patient in water, ice packs, where the arteries run close to the surface of the skin, under the arms, in the neck, between the legs and the groin area. If a patient is conscious, give him small amounts of cool water to drink. Arrange rapid transport to a medical facility. It is a medical crisis. There we go. There's a bit of a table explaining the difference between heat stroke and heat exhaustion. Just remember that at heat stroke phase, there's no ways this person can control anything that's going on in their body. They may be semi-conscious or even unconscious. All right, frostbite. Frostbite can result in exposed skin to the cold environment, especially your face, your ears, your nose, your fingertips, your lips, anything that is sticking out when you can't cover up really with clothes or things like that, where the skin is kind of thin, it's going to be exposed to and getting frostbite. The most susceptible people are weakened ones by age and medical conditions. Exhaustion and hunger can also increase the chance of getting frostbite. Okay. All right. Superficial frostbite, or called frost nip, affects the parts the body becomes numb and turns a bright red color, eventually loses its color and becomes pale. There may be loss of feeling and sensation. Warming the area must be done quickly and carefully. Do not warm by rubbing it in case you damage the skin. All right, superficial frostbite. Treat the patient for shock. Always treat the patient for shock. Care for ABCs if the patient has been exposed to extreme cold. Deep frostbite, the patient's skin will appear white and waxy. The skin may be firm or frozen. Swelling and blisters may be present. If the skin is stored, it may appear flushed with areas of purple and white, or may be mottled and cyanotic, in other words, blue in color. Lack of circulation, no oxygen. Treatment following a scene size up, primary survey assessment, secondary assessment sequence. Remove any jewelry from the patient and cover the extremity with dry cloths and dressings. Do not break the blisters. Do not rub the area. Apply heat and allow the patient to walk on the unaffected. Allow the patient to walk on an unaffected lower extremity. Okay. Do not allow them to walk on an affected low extremity. Provide prompt transport to a medical facility. Hypothermia is when a body's temperature falls below the subnormal range, about 35 degrees. Okay, the person's body is not able to produce enough energy to keep the internal temperature at a satisfactory level. Okay, people most susceptible to this include people with wet clothing, inadequate or wet clothing, individuals who are weakened by illness, and intoxicated patients, patients who have abused drugs, and especially at a high risk of developing hypothermia. You must remember, although you think alcohol warms you, it actually opens the pores in your skin and allows perspiration to flow out more easily, cooling the body extensively. Only the inside that's warm, not the outside. Okay, signs and symptoms of hypothermia: feeling cold, shivering, decreased levels of consciousness, sleeplessness, okay, lack of coordination, mental confusion, slow reactions. Body temperature goes below 32 degrees, the patient will lose consciousness, and you'll have a very weak, slow pulse, almost seem like they're dead. Okay, and the signs and symptoms, the different things, the loss of body temperature. Okay. Treatment: always remove the patient to a warm location, remove wet clothing, and place warm blankets over them or under the patient. If the patient is conscious, give them warm fluids to drink. and do not have an access. If you do not have access to a building, move the patient to a heated vehicle. All right, if transport is delayed, you may need to use your body temperature to warm the patient. Always handle the patient gently. Hypothermic patients must be examined by a physician. Okay. Cardiac arrest and hypothermia. If the body temperature falls below 28 degrees, a heart may stop and you will need to do CPR. Okay. Always start CPR and use an AED patient, even if you believe they are dead for several hours. You're not considered dead until you're warm and dead. Drowning or submersion incidents, okay, happens a lot. Drowning is a second leading cause of injury and death amongst children 1 to 14 years old. Drowning is defined as the process of experiencing respiratory impairment from suffocation or immersion in liquid. Okay, drowning, people are dead. Near drowning patients are resuscitated and they live on to lead a normal life. Submersion injuries resulted from being beneath the surface of water or other liquid. Likely locations of drowning: streams, lakes, rivers, swimming pools, hot tubs. Okay, like more likely wading pools, public fountains, storm drains and ponds. Okay, hazards from drowning in infants and young children are also present in every house. Bathtubs, buckets, toilets, things like that. All right. The process of drowning progresses through several stages. Usually the initial stage is a panic. In other instances, the person becomes frightened, fatigued, injured, cold, entangled in seaweed or kelp, experiences loss of orientation and becomes ill. A feeling of panic produces an inefficient breathing pattern. Okay. Signs and symptoms of submersion injuries: obviously coughing, vomiting, difficulty breathing, respiratory arrest, cardiac arrest, broken bones or spinal injuries, especially from diving in shallow water. Good chance of having a spinal injury or neck injury. Hypothermia when wet or the temperature is low. Always assess the scene for safety. If the patient is still in the water, do not exceed your limits of training in a rescue attempt. Don't go, rather just throw and tow. A good swimmer has been drowned by a patient that's drowning. Keep yourself safe and attempt to rescue only if you can do so safely. Okay, call for additional help if needed. If there's evidence of trauma, you need to move the patient, protect the spine, and perform a primary assessment. Obviously, when you're on solid ground, correct any airway or breathing circulation problems, begin CPR if you're indicated. Remember, you can't do compressions in water, you can only do ventilations. If the patient is breathing adequately, administer a high flow rate of oxygen, dry the patient, keep the patient covered with towels or blankets, and as soon as possible, perform a secondary survey to check for other injuries. Always remember, you need to arrange transport to a hospital. Begin CPR on a drowning victim as long as the patient does not exhibit definite signs of death, decapitation, mutilation, rigor mortis, lividity, or rigor mortis. Okay. When a person is submerged in cold water, the mammalian diving reflex may be activated. This reflex slows the heart rate and metabolic rate and decreases the body's demand for oxygen. There have been incidents of survival of patients survived for over 30 minutes due to this reflex. Okay, when you encounter a person who has been submerged in cold water, start CPR and continue until the patient has been delivered to a medical facility. Just on the drowning sort of things, remember hypotonic and hypertonic drowning and dry drowning. Where hypertonic or salt water is involved, there's always a chance of secondary drowning. Patient needs to be sent to a hospital where they can be monitored. With a hypotonic drowning or freshwater drowning, it is important to have them checked out by a doctor, but they may not have to stay in hospital for any period of time. Dry drowning occurs when a laryngospasm happens and the patient's throat is closed, stopping water from reaching the chest or going into the lungs. Lightning injuries, a lightning strike, electrical injuries as a cause of lightning strike causing cardiac irregularities or cardiac arrest. Remember, with a lightning strike, patient's probably going to be dead. You might want to try doing CPR, see if you get a response, and defibrillate if necessary or if possible. Always arrange transport to a medical facility. Okay, must remember that lightning injuries cause electrical burns. That type of burn is usually internal. The extent of the damage will not be visible away until after injury occurs. There might be an entrance wound and an exit wound. And remember, everything between the two is also burnt or charred.